Yes, it's actually a contribution. So what we see here is a clear example of not having an EU health union for so many years. So I'm very happy that we are here breaching walls. I'm from the 1,400, I represent ESPA, the European Federation of the 1,400 medical spas. In many European countries, we have medical spas as our hospitals, but we just emerged there where there is hot thermal water coming out of the ground, and that smelly water or that very colored water, there is ions and oligo elements, and you push that straight through the skin into the body. And that's how you can reboot the immune system when, for example, after the second chemotherapy, your complete gut biome is completely messed up. You're vomiting, you have diarrhea, and so forth. In France, for example, or in Germany as well, the Deutscher Heilbader-Verband, all the women who have cancer, they are all put in a bus. I'm speaking a little bit heuristically, but it is more or less like that. They are all put in a bus and they're all sent, and it's paid back by the French health insurance system. And it's like that as well in many other countries. And they are being sent to dedicated medical spas where these women are received by women who have already have been there already for 2 weeks, their hair is growing back and so forth. And it's really women helping women going through and revalidating there. So this exists in many countries. It's just that we don't know this because there was no Director General of Health helping us to coordinate and share all this knowledge. So this knowledge is now here with broken through the silos and so forth. We are also sponsoring the pediatric cancer as well. So normally your French colleagues, for example, or German ones, they should be able to inform you about all this. Thank you.
And then you need the social security to say yes for the parents, which is
just
something
a very short remark.
Yes, Peter.
If you want to have a mental health specialist to actually, be in the team, you need to have that by law. I give you an example. We had for a long time, in transplantation medicine, a lot of people, they fell out of it or discontinued, for instance, their medication, which is needed, so then they lost their organ. So then in the German system, there was by law, everyone who is now transplanted with his heart, kidney, whatsoever, needs to have an opinion by a psychiatrist. That pushed us into very much, because we have to do that sometimes overnight and things like that. But I think it reduced significantly the amount of people who then actually had problems due to mental health problems. So if you want to really, because, all the things with stigma, and so, that is getting better. But if you want to really have a step, that would be my recommendation. Try via politics and get it so it's mandatory, it's not facultative.
So I could not agree more. And if we look at, we have Europe's Beating Cancer Plan. So then we look at the country level, and so there are people who know more about that than I do, but we see that not every country has a national cancer plan. So in Austria, for instance, we don't have a national cancer plan, we have a framework, so that's more like a recommendation. So we can stick to it or not. Sometimes rather not than yes, and so these things, yes, need to be also in here. And then I would again, it links again, I think, to the stigma question also, and how we approach this topic on a systemic level. And if we look COVID, so all of a sudden, mental health was a very, very big thing, and I think in that period, the stigma or the taboo was a little less for a whole society, for the whole world, basically, because all of a sudden, mental health affected everyone, and not just the special few, like the crazy cat lady. Also, how do we talk about mental health issues, for instance? So I think we need to, destigmatize already by education in school, the ways how do we approach, which language do we use, for instance, and to make sure we don't have to always cope and just push through every negative emotion that we have, but also learn how to speak openly about that. And I think this is something that we need to tackle as a society so that it will be also easier to put these things in legislation, so that there is just no question that any ward that treats children with cancer or in follow-up care has X number of psychosocial professionals paid by the healthcare system.
We are talking about daily life, and there is something that is really important, and you experienced this. You were young, and then you had to go back to school, then to the university, if you want. I mean, that's not necessarily the path that everyone will follow, but then at a moment you will also need to find a job. That's what you are expected to do. So what you saw in this survey was that there was a little help, very few help for that.
Yeah, unfortunately, that's
Yes.
true.
And what kind of help actually did they receive?
Because we would know also there are guidelines actually that tell us what we would need. For example, this really specialized person who is equipped with all the knowledge about neuropsych and also the, for example, the neuro-oncology, pediatric knowledge, and then coordinates the communication between the schools and the clinic and the family. So this is really would be the recommendation in the guideline. But reality is that in many countries, these positions are third-party funded. For example. And this is really, but this is another good example for also the legal options. We really fight for this, to get these positions in the hospitals, because this is true for education and career support. And we really, this should be, it's a little bit getting better in the educational systems, because there are things like, for example, disadvantaged compensation written in the school law, and then you have to translate it to the teachers and really to work together to communicate what is really needed for this child. For example, a child really with above average abilities, but having problems in, I don't know, divided attention. It's really a focus problem. Yeah, and then we talk to teachers, and then this is a legal option to have this compensation. But of course, people have to know, and there's so much work to do regarding career support, and this is really what we found. And it's not enough also to ask one time about it in follow-up clinic.
Yeah.
We, of course, because adolescents are developing, and and we have to continue to address the topic, because this is really daily life for children and adolescents. Yeah, it is education and then, career. Yeah.